Most people over 60 who take supplements believe they are doing something good for their health. Omega-3 for the heart, calcium for the bones, magnesium for sleep, CoQ10 for energy, vitamin D because the doctor mentioned it once. All of them individually reasonable, all of them widely recommended, all of them sold in the same pharmacy aisle, often marketed as a heart health package. But here is what that pharmacy aisle does not tell you. Certain combinations of these supplements, combinations that millions of seniors are taking right now, create cardiovascular interactions that can raise your bleeding risk, destabilize your heart rhythm, interfere with your medications, or make your blood pressure harder to control. You are doing something you believe is helping your heart, and in some cases, it is working against it. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room, and today I'm going to show you 5 supplement combinations that are dangerous for seniors and exactly what to do instead. Stay with me. The first dangerous combination is omega-3 fish oil with blood thinners or aspirin. Omega-3 fatty acids have genuine cardiovascular benefits. They reduce triglycerides, reduce arterial inflammation, and in high doses have been shown to reduce cardiovascular events in specific patient populations. The problem is that omega-3 also has blood-thinning properties. It inhibits platelet aggregation, the clumping of platelets that is part of normal clot formation. In a person already taking warfarin, rivaroxaban, apixaban, or even daily aspirin, adding high-dose omega-3 creates an additive blood-thinning effect. The risk of abnormal bleeding, bruising that won't stop, gastrointestinal bleeding, post-surgical complications, increases meaningfully. Doses above 2 grams per day of combined EPA and DHA carry the most significant interaction risk. Many commercial fish oil capsules contain 1 gram per capsule. People taking 3 capsules daily, which seems reasonable, are already in the interaction zone. What to do? If you take any blood thinner or daily aspirin, tell your doctor exactly how much omega-3 you are taking before your next appointment. Ask whether the dose needs to be adjusted. Do not assume your doctor knows. Most supplement use is never documented in the medical record. The second dangerous combination is calcium with magnesium at the wrong ratio. Calcium and magnesium are both essential minerals for cardiac function, but they work in opposition at the cellular level. Calcium promotes muscle contraction, including the contraction of heart muscle and arterial smooth muscle. Magnesium promotes relaxation. The ratio between them matters. Many commercial bone health supplements contain high-dose calcium, 1,000 to 1,200 milligrams, with minimal or no magnesium. When calcium is taken in high doses without adequate magnesium to balance it, the effect on arterial smooth muscle can include increased vascular resistance and elevated blood pressure. There is also an emerging concern about calcium supplementation and arterial calcification, the depositing of calcium in arterial walls rather than in bone. Multiple studies have raised questions about whether high-dose calcium supplementation increases cardiovascular risk, particularly in older women. The data is not conclusive, but it is significant enough to warrant discussion with your doctor. What to do? If you take calcium supplements, check the magnesium content. A calcium to magnesium ratio of 2 to 1 is generally considered safer than high calcium alone. And ask your doctor whether your calcium intake from food alone, dairy, fortified foods, leafy greens, may already be sufficient without supplementation. The third dangerous combination is CoQ10 with blood pressure medications. CoQ10, coenzyme Q10, is a legitimate supplement with real cardiovascular data behind it. It supports mitochondrial energy production, it has antioxidant properties, and it is particularly relevant for people on statins because statins deplete CoQ10 levels as a direct consequence of their mechanism. The interaction risk comes from its blood pressure lowering effect. CoQ10 has a modest but real blood pressure lowering action. In people already taking antihypertensive medications, particularly calcium channel blockers or ACE inhibitors, adding CoQ10 can produce additive blood pressure reduction that pushes pressure too low. Hypotension, abnormally low blood pressure, in older adults causes dizziness, falls, and in severe cases, fainting. Falls in people over 60 are a leading cause of serious injury. A supplement that lowers blood pressure on top of a medication that already lowers blood pressure creates a fall risk that nobody mentioned when you bought the bottle. What to do? If you take blood pressure medication and want to add CoQ10, tell your doctor first. Start with a low dose, 100 milligrams, and monitor your blood pressure at home for the first 2 weeks. If your readings drop significantly below your usual baseline, discuss dose adjustment with your physician. The fourth dangerous combination is vitamin D with calcium in high doses. Vitamin D and calcium are frequently recommended together, and for good reason. Vitamin D enhances calcium absorption in the gut. Without adequate vitamin D, calcium supplementation is less effective. But this synergy becomes a problem at high doses. Vitamin D toxicity, which can occur with supplementation above 4,000 IU daily over extended periods, causes hypercalcemia, an abnormally high level of calcium in the blood. Hypercalcemia produces cardiac arrhythmias, weakness, confusion, and kidney damage. More commonly, the combination of high-dose vitamin D with high-dose calcium supplementation in people who also consume significant dietary calcium can push total calcium intake into a range that affects vascular function and kidney health without reaching the threshold of frank toxicity. The compounding effect is invisible on standard blood tests unless specifically tested, and many physicians do not routinely check vitamin D levels or calcium levels in asymptomatic patients. What to do? Ask your doctor to check both your vitamin D level and your total calcium intake, from food and supplements combined, before continuing or increasing either. The optimal vitamin D range for cardiovascular benefit is between 40 and 60 nanograms per milliliter. More is not better. The fifth dangerous combination is any supplement with grapefruit or grapefruit juice. This one is not about supplements interacting with each other. It is about supplements interacting with medications through grapefruit. Grapefruit contains compounds called furanocoumarins that inhibit an enzyme in the gut, CYP3A4, responsible for metabolizing a large number of cardiovascular medications. When this enzyme is inhibited, blood levels of the medication rise significantly above what the prescribed dose was intended to produce. Statins, particularly atorvastatin and simvastatin, are strongly affected. Calcium channel blockers, including amlodipine and felodipine, are affected. Certain blood thinners are affected. Many people take supplements as part of a morning routine that includes grapefruit juice. The grapefruit inhibits the enzyme. The statin or blood pressure medication is absorbed at 2 to 3 times its intended level. The patient experiences side effects, muscle pain, dizziness, excessive blood pressure lowering, and either attributes them to aging or reports them to their doctor, who adjusts the medication dose upward, not knowing about the grapefruit. What to do? If you take any cardiovascular medication, eliminate grapefruit and grapefruit juice from your routine entirely. The risk is not worth the nutritional benefit. Oranges and other citrus do not carry the same interaction risk. I want to tell you about a woman I'll call Catherine, 71 years old, retired pharmacist, which makes what happened to her both surprising and entirely understandable. She knew medications. She understood interactions. What she had never thought carefully about was her supplement stack. Omega-3, 3 grams daily. Calcium, 1,200 milligrams. Vitamin D, 5,000 IU. CoQ10, 200 milligrams. All carefully chosen, all individually reasonable. She was also on apixaban for atrial fibrillation and amlodipine for blood pressure. She came to me after a prolonged episode of bruising following a minor fall. Bruising that was far more extensive than the impact should have produced. She was also experiencing episodes of dizziness when standing. We reviewed her complete supplement list. The omega-3 at 3 grams was amplifying the blood-thinning effect of her apixaban. The CoQ10 at 200 milligrams was adding to the blood pressure lowering of her amlodipine, producing postural hypotension and the dizziness she had been experiencing for months. She had attributed both symptoms to aging. They were supplement interactions, entirely preventable, entirely fixable. Her omega-3 was reduced to 1 gram. Her CoQ10 was reduced to 100 milligrams. Both symptoms resolved within 3 weeks. She told me something that I think about often. She said, "I spent 30 years counseling patients about drug interactions. It never occurred to me that my supplements needed the same conversation." It never occurred to her. Because supplements are sold as food, as natural, as safe. And in the right dose, in the right combination, for the right person, they often are. But natural does not mean interaction-free. And safe alone does not mean safe in combination with everything else you are taking. You are not a passive consumer of whatever the supplement aisle recommends. You are an active participant in your own cardiovascular health. That means bringing your complete supplement list to your next appointment, every bottle, every dose, and having a real conversation about what you are actually taking. Let me bring this together. 1. Omega-3 with blood thinners or aspirin, additive bleeding risk above 2 grams daily. 2. High-dose calcium without adequate magnesium, elevated vascular resistance and potential arterial calcification. 3. CoQ10 with blood pressure medications, additive pressure lowering, fall risk. 4. High-dose vitamin D with high-dose calcium, hypercalcemia risk, and cardiac arrhythmia. 5. Any cardiovascular medication with grapefruit, enzyme inhibition causing 2 to 3 times the intended medication level. Bring your supplements to your next appointment. Every bottle, every dose. Ask your doctor and pharmacist directly, are there any interactions between what I am taking and my medications? That conversation could change everything. I want to hear from you. Have you ever experienced a side effect that turned out to be a supplement interaction? Has a doctor ever reviewed your complete supplement list? Tell me in the comments. I read every single one. If this video gave you something useful, share it. Not for me, for someone in your life who takes supplements every morning, believing they are only doing good. Send this to them. It could protect their heart. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Never stop or change any supplement or medication without speaking to your doctor first. Take care of your heart. It has been working for you every single minute of your life, without ever asking for anything in return.